Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today we welcome Timothy McDonald. He's a physician executive, and today's Kevin MD article is How Public-Private Partnerships Are Reshaping Patient Safety. Timothy, welcome to the show.
Oh, I'm so glad to be here, Kevin. I love the work you do pushing out all these important messages to healthcare.
Well, thank you so much for coming on. So just briefly share a little bit about your story and journey before we talk about your article.
Sure. So I am, as you mentioned, a physician executive. I actually did residencies in pediatrics and anesthesiology and a fellowship in peds anesthesia critical care, all in Boston. Moved to Chicago in 1989 and got heavily involved in legal issues due to my work of children who'd been abused. And so I decided, Kevin, to go to law school at night while practicing my anesthesia and critical care during the day, became a licensed attorney in 1997, have been that since then. And so I've worked at the interface of medicine and law for the last 27 years. And that's how I got heavily involved in patient safety issues when the IOM report came out. And then a lot of the professional liability problems we ran into in the early 2000s. And so that's been my focus, is on that. My research has been focused on patient safety, and a lot even alluding and going into the article, the need to create partnerships between our healthcare organizations and providers and so many other groups, like patients and families, like professional liability carriers, and even like technology companies who really can help us with the data so that we can begin to get safer, because we know we have huge problems still in patient safety in the country.
All right. Your Kevin MD article is titled How Innovative Partnerships Are Transforming Patient Safety in Healthcare. Talk about the events that led you to write this article in the first place.
Well, I can tell you that many years ago when I was an executive, working in Chicago, we had a patient who ended up having a missed critical test result, Kevin, and we as an organization missed it. She got discharged from our hospital and she ends up dying 6 weeks later. The test result that we missed was a very abnormal white count that indicated that she might have leukemia. When we learned about it at my hospital and we wanted to reach out to her family, the legal system at the time said, we don't do that. It's a recommendation you've heard over and over about, don't say anything and just hope it goes away. Unfortunately, the family was medically savvy. We ended up getting sued. We spent hundreds of thousands of dollars defending the indefensible. We learned very little, and we settled for millions of dollars on the courtroom steps. And at that point, I realized we first needed to create partnerships based in transparency and empathy with patients and families. And then we took it from there to a whole lot of the other, work that we can talk about.
All right. So talk about these partnerships as you discuss it in your article.
So one of the first big ones that we discovered really was partnering with patients and families. In fact, very early on in a lot of the patient safety work, as you may be familiar, and it's in the article, is, CMS had this partnership for patients that started many years ago. And we found by doing that, we could really reduce the number of harm events in healthcare. It was hugely powerful and productive in that kind of partnership. But it goes on further to, we know, Kevin, that we can't fix what we don't know about. There's a lot of data that's out there, but it's not actionable. And so one of the other big partnerships is, how do we get this data, for example, into patient safety organizations so we can create learning from one health system to another health system? It's like what aviation does. That's a huge partnership that we are able to do on the data side, often partnering with government like CMS in some of these projects. The other big one I'm really happy to be involved in is the partnership between the organizations and their liability carriers. The liability carriers can really leverage and support and promote patient safety because they often are the ones that incentivize it. And so this group I work with, the Beta Healthcare Group in California, is incentivizing nearly 60 of their hospitals to create this kind of partnership between the organizations as well as patients and families so we can learn from some of these kind of events. The other big one is on the technology side. I work with a technology company. One of the things that we're able to do is to bring all of this disparate data together, turn it into actionable data, especially now with artificial intelligence, so we can give feedback to hospitals to understand ahead of time and even proactively how might we prevent all these patient harm events from happening anyway? You know, the data that we shared shows that 1 in 4 patients suffers an adverse event in a hospital. Of those, 1 in 4 is preventable, which means 10% of all of our patients in hospitals suffer preventable harm.
Mhm.
We need these partnerships. We need to be able to leverage this data to make care safer.
So, give us an example or paint a picture of what a partnership with these patients and families, what would that look like?
Well, so I mean, I can tell you for sure that what we've learned very early on, and it's well published, Kevin, is that when harm happens in hospitals, the only person there the entire time is the patient or the family member.
Hmm.
And too often, when we have these harm events happen in hospitals, we don't get their input. And when we decide to change the way we're going to deliver care, we're not actually talking to the people most affected by the change. And so, what CMS has put forward with their patient safety structural measure is this idea that we need to partner with them, get their input into what these harm events are, so we can begin to fix it and make it better in the future. An example would be we had one of these cases where I worked where it was the family that shared with us, Kevin, that those in respiratory therapy coming in the room, some of them wore gloves and washed their hands. Others didn't wash their hands and wear gloves. We never knew that without talking to patients and families. We were able to make a big change based on that and started reducing infections related to that. You don't get that unless you partner with patients and families to learn what it is that's happened. There's also a lot of issues these days, as you know, in diagnostic error. And that means we need to partner more with patients and families to get their insights into what's happening to their body in a way we can better make the appropriate diagnosis taking care of them. So lots and lots of examples showing if we engage patients and families, we can make a difference. There was a study out of Texas that showed when you interview patients and families after harm events, you find 80% more strong process improvements, and you do begin to reduce harm. So that's just one of the examples of working with patients and families and the difference that can make.
When you first introduced yourself, you told a story about how, from a legal standpoint, they wanted you to reduce that transparency and not talk about that error. So, do you still have that cloud of legal suspicion that kind of interferes with that transparency, or have they come to accept that open partnership between medical error and being transparent with patients and their families have a net benefit?
Well, we've now been able to publish a lot of data, Kevin, with all of the stakeholders we work with, all these partnerships. And we've been able to show that transparency and empathy and honesty after harm does not increase the likelihood of liability and lawsuits. You actually do get safer and you do drive claims down, which is why one of the partnerships that I work with is that Beta Healthcare Group in California. This is why they're incentivizing, Kevin. They're the liability carrier. They're incentivizing their hospitals to be open and honest with patients because they know not only will it provide safer care, but you will end up having decreased claims. There's a financial ROI that goes along with this. And again, we've been able to publish this. It was a lot of the work that I did that was part of, now this is a partnership with the federal government, the Agency for Healthcare Research and Quality that funds a lot of this research. We were able to show this approach helps make care safer, and it does decrease claims and lawsuits. And so with that, we've begun to shatter the wall of silence. More and more organizations around the country are learning this message and beginning to look at it from this way where you have these stakeholders that you get involved in doing this kind of work. It's one of the other reasons why CMS is now recommending that all organizations in the country adopt this transparent approach, which is kind of cool to see because this has only been about 15 years. And a lot of us out there in the field are very, very happy to begin to see the message is getting out there. It's good for patients and families. It's also really good for us providers. I mean, as you can imagine, as a doc, when we're involved in a harm event, especially if we've made a mistake,
Mhm.
you can suffer great emotional angst with this. So part of the work within organizations is how do we make sure we provide peer support to the nurses, to the docs, to the pharmacists who may be involved in some of these cases, like that one I mentioned early on in the podcast. The people involved in that case, Kevin, were horribly affected by it. And so part of it is making sure that we're working with the staff to understand how they may be suffering from some of these harm events.
So talk to us about some of that support, because sometimes when multiple individuals from a healthcare institution are involved with a harm event, they're instructed by some malpractice carriers not to talk to one another about the case, right? They have to proverbially suffer in silence. So when you talk about support, peer support, support for the staff members, what would that look like optimally?
So there's often three tiers, Kevin, and I give credit to Sue Scott from Missouri for this. But the kind of support that we teach and train organizations is what we call tier two, which is peer support. It's where you train doctors to support doctors, nurses to support nurses, where you're providing almost immediate peer support for those involved in these events. The power of this was highlighted in an article by Albert Wu in the BMJ. He kind of called it the second victim. We don't use that term anymore. We really talk about more the traumatized caregiver. But you literally build a program, Kevin, in your organization where you have trained peer supporters. So when you have one of these events, and you can often support it with software, when you have one of these events, you can make sure that a trained peer supporter reaches out to the doc proactively to check in on them and see how they're doing. And that data is amazing to see what the impact this has. In fact, we had the opportunity to publish an article in the New England Journal about why this was so important, especially during COVID. So what you do is you reach out to the doc, you just check in, you make sure that they know as an organization you support them, you'll be there for them. And if you do that, those who experience that kind of support from the hospital have half the burnout of those who don't get support. And actually the units they work in have lower mortality rates. Mm-hmm. So again, this is connecting the data all together, showing that this is a hugely important thing. Now, back to your point, when we teach and train this, Kevin, we talk to peer supporters about the need to not talk about the event itself, just focus on the emotions and the struggles that people are having. And that way you can even assuage the fears of some of the defense attorneys and others, because you're not talking about the specific facts of the event. That's another part of the organization that takes care of that part. But it's a great partnership. The organizations with their individual staff often, again, needed to support it through software, because you got to track whether or not you've been able to get peer support, to these people and see it. You also want to track your data to show, have we reduced burnout? Because the data does show you will. Do you increase retention when you go doing that? So the partnership also is the one between staff and the organization, because they have all these insights in what's happening.
So give us a sense about how prevalent this transparent approach is in the country when it comes to medical errors and medical harm. So is what you're describing commonplace? Do we have room to move? Is it in a minority of institutions? Just give us a sense of how prevalent it is.
So, for example, I can tell you in California, a large number of the hospitals in California are doing this, in part because of the incentivization from the professional liability carrier. But I'm working with more than 800 hospitals around the country in this space, some very big health systems. So I would tell you there's been a lot of momentum since we published our data, Kevin, showing the positive ROI from an emotional standpoint and a financial standpoint. It is beginning to spread around the country. There's a lot of momentum with that. In fact, there's been legislation passed in Iowa, Colorado, Minnesota, and Utah that enables this kind of activity. So we're making a lot of progress, and that's why it's so great to be on your podcast, because a lot of what you do, a lot of what you all do, getting it out to the public helps to create this momentum. It helps encourage these kind of partnerships we've been talking about. And that's why I'm just so thankful to be able to get on the podcast and chat with you about it.
So those states that you mentioned that are creating legislation to encourage these partnerships, what are some examples? What exactly does that look like? Is it some malpractice protections? Is it how are they encouraging it through legislation?
Oh, that's a great question. And I can share with Colorado, because we do a lot of work in Colorado. There's a woman there named Jean Martin who runs a lot of the work in Colorado. She's a doc and an attorney as well. So that legislation, what it says is, it says if there's one of these harm events, you can reach out to the patient or family to have what's called a candor conversation, which candor stands for communication and optimal resolution. If you do that, you do it in a protected space. And you are encouraged to try to resolve it with the family without litigation. If you're able to do this, this is a critical part of it, and it is resolved in that way, then because you're being proactive, you're reaching out to the family, they've not filed a claim or a lawsuit, there's no need, Kevin, to report people to the National Practitioner Data Bank. And by that state law, you don't have to report the docs or the nurses to the state licensing boards. Because that's one of the big fears, right? That docs don't want to be transparent. And so this encourages and enables that. And it's why there's been a huge increase in this partnership, in this ongoing conversation. The other thing they've done in Colorado, they've created a repository of learning from these kind of events. And it goes back to what you and I talked earlier on. It's this idea of taking our data, getting into patient safety organizations so you can learn from it. Colorado's actually doing it based on these kinds of cases. So again, it gets back to the technology connection with the human connection in some of these harm events. And so the legislation in Minnesota and in Utah and in Iowa is very similar to Colorado. It incentivizes us to do the right thing, and you're not punishing people by reaching out and being open and honest and learning from these cases.
Now, you alluded to this earlier in terms of the impact on patients, but go into a little bit more detail. How are patients responding to this transparency in general?
So, I mean, in general, and this is an important part of it, there is a great deal of relief from them when they learn what happened to their loved one. In fact, there's a lot of data, Kevin, to show if you don't have these conversations, and as life goes on and they know these harm events have happened and they didn't get transparency, they themselves become less trusting in the healthcare system. So when you're open and transparent, there was a recent article published showing they're much more likely to trust the healthcare system, and they can be very forgiving when they learn what it is that's happened if you are committed to try to make sure the harm doesn't happen again. In fact, one of the things we recommend is if you've had a tragic harm event, you offer the patients and families the opportunity to be part of the improvement. And that's one of the other partnerships. And as you gather that data and you put it into your software, you can track the positive impact it's going to have. So in general, that's what we hear from patients and families. They want to know what happened. They want to know what you're going to do to make sure it doesn't happen again. And appropriately, sometimes it is appropriate to provide financial resolution for them when it's been a serious harm event with a lot of damages that may have gone on with that.
We're talking to Timothy McDonald. He's a physician executive, and today's Kevin MD article is How Innovative Partnerships Are Transforming Patient Safety in Healthcare. Timothy, let's end with some take-home messages that you would like to leave with the Kevin MD audience.
Well, I think the primary thing is that if we are going to improve healthcare, in other words, the primary message is we still have patient safety problems within the country. To fix that, we need a paradigm shift. We need transparency, we need honesty, we need empathy, and we need to learn from these events. And that's where, now that we're seeing these huge improvements in AI, the huge improvements in capturing data, we need to take this data, using AI to understand how do we prevent these harm events in the first place before they ever happen, and track whether or not the improvements we're making do make a difference. And I really, really am trying to encourage that partnership between all healthcare providers and organizations and patients and families, because together, I think we truly can become safer, but it's going to require this sort of paradigm shift in what we're doing.
Timothy, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you, Kevin. It's been an honor and a privilege to chat with you.